Hi, everyone. I'm Susan Brady. For those who don't know me, I am a physical therapist of 35 years, as well as a doctor of integrative medicine and a certified integrative health and nutritionist. And I specialize in bone health. And my practice, Nurtured Bones, focuses on a holistic approach to building strong, healthy bones. Today, I'm thrilled to introduce you to an innovative bone imaging technology that I've been exploring for the past few years. This cutting-edge method, known as Echolight, utilizes REMS technology to provide an advanced insight into bone health. Echolight uses REMS technology, and REMS stands for Radiofrequency Echographic Multi-Spectrometry. So it uses ultrasound, not X-ray, to generate sound waves, and these sound waves bounce off your bones, creating echoes. The echoes are then recorded and mathematically processed to determine the density as well as the strength of your bones. So the echo from a strong, healthy bone will be different than an echo from a low-density, weak bone. And the measurements obtained by the Echolight comply with all the standards established by the World Health Organization for bone assessment. So it generates a medical report that includes bone mineral density and a T-score, just like your traditional Dexa scan does. But on top of that, it generates what is called a fragility score, which represents the quality of your bone or the inner structure or architecture of the bone. And this is important because bone density is only one piece of the puzzle. You can have great bone density, but of poor bone quality or structure and fall and fracture. Or you can have lower bone mineral density, but the bone you have is of really good quality, and you'll have a decreased risk of fracturing. So unlike the traditional methods that primarily focus on bone density, Echolight's REM technology provides an assessment of both bone density and quality, often offering a more complete picture of your bone health. Now, many of you are probably familiar with a Dexa scan and probably have already had one done. And Dexa scans have long been the benchmark for assessing bone mineral density, providing data for diagnosing osteoporosis and other bone health issues. However, despite its status as the gold standard, Dexa has several notable limitations. So while Dexa scans measure bone density, they fall short in offering a complete picture of bone health because they do not account for bone quality, which is a significant factor in overall bone health and fracture risk. These limitations mean that relying solely on Dexa can lead to an incomplete assessment of a patient's fracture risk. The accuracy of Dexa scans can also be affected by various factors, including patient positioning and the interpretation of results. And these factors contribute to a higher error rate, which can then impact the reliability of the diagnosis and subsequent treatment plans. The use of low-dose X-rays in Dexa scans introduces a level of radiation exposure. While considered safe, this exposure can be risky for vulnerable populations such as pregnant women and certain cancer patients. So it's essential to weigh the benefits and risk when considering Dexa for these particular groups. Additionally, Dexa scan results can vary between different machines and even depending on the time of day that the test is performed. So for instance, if your initial Dexa scan was conducted at one facility and your follow-up scan 2 years later was done at a different facility with a different machine, the results may not be directly comparable. Enhancing bone strength isn't just about increasing bone density. It's a combination of bone mineral density and bone quality. And this is where the Echolight stands out, offering measurements of both bone density and quality. And experts in the field highlight that bone mineral density accounts for about 60 to 80% of bone strength, while bone quality contributes to about 20 to 40%. Therefore, assessing fracture risk involves more than just measuring bone density. And research shows that the Echolight's fragility score is the most accurate predictor of fractures, outperforming the traditional T-score, which only reflects bone mineral density. And the primary goal of any bone scan is to gauge fracture risk and aiming to prevent fractures. And many people don't realize that even with osteopenia, which is a condition of reduced bone mineral density, but not severe enough to be classified as osteoporosis, there is still an elevated fracture risk. So understanding your fragility score enables early identification of high-risk people, helping to prevent fractures more effectively. If we look at these two bone scanning technologies side by side, Dexa scan utilizes low-dose radiation, which can be harmful, especially for pregnant women or cancer patients, whereas the Echolight uses ultrasound technology, not X-rays, making it safer for all individuals. With a Dexa scan, it typically requires about 2 years to detect changes in bone mineral density, which can be a long time for patients monitoring the effects of their diet or exercise or medications on their bone health. In contrast, the REMS technology can detect bone mineral density changes of less than 1%. So that allows for more frequent assessments and better monitoring. The Dexa scan only measures bone density, whereas the Echolight measures both bone density and quality, providing a more comprehensive assessment of your bone health. And many limitations with the Dexa scan, as we discussed before, but they can also be influenced by the presence of osteoarthritis in the spine and may have limited use for people with spinal deformities like scoliosis or for individuals that have had previous spinal surgeries. The REMS technology is not affected by osteoarthritis or any kind of spinal deformities in the spine. And they can actually also be performed on individuals that have had spinal surgery with perhaps the placement of hardware or even after a kyphoplasty. Errors in the Dexa scans are common. In fact, according to a 2019 study in the Journal of Densitometry, Dexa scan errors were found throughout the study, technical errors in 90% of the patients, which can come from incorrect positioning on the table or perhaps the patient moving during the scan. They also found incorrect interpretation of the test. This study found interpretation errors in 80% of patients, and 42% of these interpretation errors were major errors, leading to incorrect information on bone mineral density changes, as well as incorrect diagnoses. Whereas a 2021 study reported in the Archives of Osteoporosis that compared REMS technology to Dexa showed that REMS approach is highly accurate and reproducible for the diagnosis of osteoporosis. And in adult women, REMS demonstrated high accuracy compared to the Dexa. So even though the Dexa is considered the gold standard, it does not mean it's a perfect test. It is just the best test we currently have until now. Echolight with REMS technology truly introduces a groundbreaking approach to evaluating comprehensive bone health and fracture risk. Unlike traditional methods that only measure bone density, Echolight assesses both the density and the quality of your bones, and this dual approach is going to give you a clearer picture of bone strength. By understanding your bone density and quality, you can then take proactive steps to maintain strong, healthy bones. And that may mean through diet, exercise, and lifestyle changes, or it may mean through taking medication. Remember, our bones are alive and continuously remodeling as we age. And by understanding the strength and the health of your bones will then empower you to make informed choices and stay ahead of any potential issues. Don't wait for a fracture to prompt action. Invest in your well-being now. Invest in the well-being of your bones and embrace a future of strength and resilience. I am thrilled to announce that Echolight scans will be available in Northern Virginia on Saturday, September 14th. These scans will be conducted at Great Falls Pilates in Great Falls, Virginia. This is an incredible opportunity to gain a comprehensive understanding of your bone health using this cutting-edge REMS technology. The cost of the scan is going to be $300, and unfortunately, because it is such a new technology, health insurance does not cover these scans at this time. However, the investment into your health is invaluable, and it's going to provide critical insights into your bone strength and quality. For more information or to schedule a scan, please contact either myself or Ashley at the provided email addresses seen here. And then additionally, there'll be an opportunity for a discounted consultation with me to create a personalized bone health program tailored to your Echolight scan results. Let's work together to build a future of strong, healthy bones. Don't wait. Take the proactive steps towards better bone health and schedule your Echolight scan today. Thank you for joining me, and please reach out and let's get you scheduled.